Okay, everyone, let's go ahead and get started. Hello, and thank you so much for joining us today for our webinar to discuss the importance of securing and maintaining a concierge advocacy solution for your clients or within your organization, and how benefits advocacy can reduce claims in a variety of ways, support lean HR teams, and improve the overall employee experience within your company. I'd like to ask if you have any questions throughout this presentation, feel free to please place them in the chat. And at the end of the presentation, we'll do our best to go ahead and answer as many questions as possible. All right, so joining us today is the Associate Director of Benefits and Compensation from our wonderful client partner, Apellis, Sam Gentile. Sam, thank you so much, and we look forward to hearing your thoughts regarding the impact of advocacy within your role and your organization. My name is Cody Gill. I'm the Vice President of Client Success at TouchCare, and without further ado, let's go ahead and get started. The first topic that we will address today is, what is concierge really? Oftentimes, individuals may have an idea, but might not look at the impact that advocacy support provides holistically. As you can view on this slide, there are a variety of ways professional and knowledgeable advocates support employees and clients: avoiding or correcting billing errors, researching, scheduling appointments with, and coordinating with providers, educating employees on their entire benefits package, and helping them select the best health and supplemental plans based upon their unique needs, explaining benefits clearly with language they can understand, and assisting them with challenges, leveraging industry professionals. So by providing a white glove support approach and leveraging experts to assist with thousands of similar cases to create a resolution, many costly issues can be avoided that impact claims, employee productivity, employer liability due to extensive PHI access, and even company culture. I'm sure that when Sam will provide additional insight into the direct impact TouchCare has made for both her and her employees when we speak to her later in this presentation. So we really look forward to hearing from you, Sam. The key to concierge is not necessarily resolving issues on behalf of employees. The key is to leverage every interaction as an opportunity to, yes, provide support and resolution, but especially to educate, creating better long-term consumers. Oftentimes, our team saves employees and employers and even broker partners hours of time spent researching and resolving issues. Employees can reach out with simple benefits questions, but oftentimes they're contacting our team when they need more complex assistance, when they simply don't have time to perform a task independently, or when they're experiencing something very serious and do not understand how to navigate the process. The best outcomes occur when employees contact our team proactively, before a test, before a procedure or a medical event. Most billing and claims or costly issues, both financial and physical, can be avoided with proactive advocacy and health management. On that note, let's go ahead and discuss billing review and negotiation. We are extremely fortunate to have a team of billing professionals within TouchCare who have many years of complex billing management and resolution experience, coding experts and insurance experts who understand every possible scenario regarding bill review to determine if an individual was billed correctly or incorrectly, and how to determine the best course of action for resolution on the member's behalf. 50% of the bills that we receive from our members contain an error and require our correction assistance. This could be something simple, like an overpayment of a copay, or something extremely significant. With incorrect bills, advocates determine the path of least resistance for correction, and they contact the providers, facilities, and the carriers on the member's behalf, while educating the member and keeping them informed each step of the way. As you can see by the statistics on this slide, the average per employee savings when we correct a bill on a member's behalf is approximately $564. That is a significant amount when considering the entire population. That said, 50% of the bills that are submitted to our team are correct. The explanation of a bill that is correct is also extremely important. This member interaction creates a proactive educational opportunity to help them understand their benefits more effectively, resulting in a better long-term healthcare consumer. The key is leveraging professionals who can dissect a bill and determine the next best step with the ability to contact the entities involved on the employee's behalf. When a professional who can speak through the why contacts a provider or facilities billing office or a carrier on behalf of the employee, resolution occurs quickly and efficiently. Leveraging billing specialists to assist employees saves a tremendous amount of time and frustration on behalf of the member, employers, and our broker partners. Billing is a significant component of advocacy, but let's talk about proactive member management, which creates the best outcome for members. One of the key areas that drives brokers and clients to consider an advocacy solution is typically cost containment and transparency. Before we dive into price transparency and cost comparisons, let's agree that driving consumers to low cost, high quality options is one of the ways to reduce claims, remembering that every advocacy interaction actually impacts costs and claims long term by creating a better understanding of healthcare and benefits navigation. That said, the importance of cost transparency and navigation is extremely significant. Within TouchCare, employees might not reach out to say, TouchCare, how much does this test or procedure that I am considering or will be having cost? Instead, oftentimes employees contact our team with a benefits question, asking for assistance regarding a better understanding of coverage for a cost or procedure, or for our team to research high quality specialists, providers, surgeons, or facilities. The advocate's job is to recognize a red flag within the question and to ask the member additional questions, to then explain what contracted negotiated rates means, and to begin the navigation process to provide more information than what the member asked initially. Remember, TouchCare advocates are experts. Advocates should not simply provide an answer to a question asked. They should use their expertise to assist the member as extensively as possible, avoiding billing errors, ongoing healthcare challenges, or expensive readmissions. When our team provides cost comparisons to employees, we leverage a variety of different resources as a starting point. After assessing the in-network options that align with employees' carrier and the plan, there is not one outstanding resource in the world of healthcare regarding transparency, which is why we rely on a variety of technical and manual tools and workflows to obtain information. So after assessing the lowest cost, highest quality options, we then provide in-network options to our members based upon our research with detailed out-of-pocket costs. We help them understand next steps and if the test or procedure they are having is subject to their deductible, how much they've met year to date, if authorizations are needed, and anything else that might apply. Finally, we offer to schedule, assist with any next steps, and assure the member that we're here for anything that they might need or that their dependents might need on an ongoing basis. If a member is having a procedure that includes anesthesia, we also use this opportunity to ensure the facilities and additional specialists like that anesthesiologist are in network prior to the event. At TouchCare, a member works with the same advocate within their dedicated service pod from start to finish. So now let's discuss the importance of provider search assistance. In today's world especially, finding providers is not as simple as it may sound. Oftentimes, employees enter a carrier site or begin calling providers blindly when they're managing this area independently. Let's be frank, oftentimes carrier sites could be a bit more accurate than they actually are. When a member contacts our team in need of any type of provider, a PCP, a surgeon, any specialist, a dentist, we first ask the employee, do you have any specific requests? Do you prefer male or female? A specialized social focus? A provider closer to work or home? Learning what makes the employee feel most comfortable is important as it increases the follow-through and comfort of the care they will receive. We then assess the employee's plan to determine any considerations that need to be considered. We assess the quality of the options available, leveraging a variety of different resources, which are different depending on the request. And we then contact the provider's offices to ensure they are, in fact, still in network, determine their availability, and ensure that they are accepting new patients. Finding providers will be ineffective if an unvetted list is sent to members without advanced research. After we find the top 3 providers and we provide them to our members, we offer to schedule an appointment on their behalf. This is, again, a very important proactive step toward health management. As mentioned earlier, a provider search request could raise a red flag for our team, resulting in more in-depth coordination or a different approach, including cost comparisons and proactive procedure management. We've been focused on healthcare throughout this presentation, so let's discuss other ways TouchCare can assist our members. Our experts are not only top resolution professionals, they're educators and traffic cops, supporting the entire benefits package. We work in support pods, allowing our team to become experts on the entire benefit solution offered to employees by their employers. Our team understands if an employer has offered accident coverage, hospital indemnity plans, FSAs, HSAs, HRAs, and EAPs, for example. We assist employees with each of the benefits offered, and we leverage the benefits to remind members when those benefits apply. For example, if a member has a behavioral health request, we remind them of any virtual options that might be available, like perhaps our MindCare solution or their EAP. If a member calls us with a somewhat minor medical need, we remind them of their telehealth solution versus urgent care or the ER, and we help them obtain access. So as stated throughout this presentation, with advocacy, education of all of the benefits is key. We believe in providing an educational experience through every interaction from inception. Offering one-to-one open enrollment consultations allows us to begin the member education process before a member even selects their plan. Educating members regarding each of the benefits that will supplement their needs, and then leveraging each interaction to create better consumers creates a substantial long-term solution to the many issues regarding the complicated healthcare system for our clients and for our members. We poll our members to understand the impact of their interactions with our health assistants. Beyond our consistent 98% member satisfaction rating, we have also realized that 65% of our members state we have significantly increased their understanding of their benefits simply by them contacting our team for assistance. We realize that engagement with members and with clients is key. So let's discuss how we drive engagement with our clients and with our member population. Partnerships with HR and with our brokers are not taken lightly at TouchCare. Ensuring that all stakeholders have a thorough understanding of our solution, access to a dedicated account manager, and escalation managers is vital. This is a very important component of creating engagement. Ongoing, we educate our members with impactful resources, webinars, materials, and provide a variety of ways they can contact our team. We recognize that everyone communicates differently. And while some individuals are more comfortable using our technology, many prefer to discuss complex issues directly with a specialist via phone. Helping employees understand what we can assist them with and remaining top of mind is key, as not everybody has an immediate need, so they need to be reminded of the solution when they do have that need. Like members, clients also communicate with their population in different ways. During our initial client orientation calls, we discuss how employers engage with their employees. We then strategize ongoing engagement to align with internal strategies and initiatives, even leveraging some of their internal solutions, like HRIS or their Slack channel. However they communicate, we like to mirror that communication. With members, we work to remain top of mind, providing monthly email campaigns and incentives, direct mailing upon client request, incentivized educational webinars, and other notifications that align with outreach or wellness initiatives. Before we officially introduce Sam, who will discuss the impact of TouchCare within her organization and her role, we love to share our member comments and testimonials. So this is a brief comment, and it's an example of the impact that TouchCare provides to our members daily and the impact of advocacy in general. They've done a spectacular job in dealing with all of those horrid interactions on my behalf. Despite not being a millionaire, I feel privileged to have this type of concierge service. It's very important that organizations do provide support within their benefits to their population. And our goal is always to provide the best possible experience, regardless of who that employee might be. All right. So, Sam, I'm sure everyone will appreciate hearing your voice after listening to me talk through our first several slides. Welcome to the discussion, and thank you for joining us today.
Thank you for having me.
All right, let's go ahead and get started. I'm going to ask you a few questions, and we can keep this interactive, and I'm sure everyone will appreciate everything that you have to say.
Sounds good.
All right. So, what were your pain points before utilizing a concierge service?
So one of the biggest ones is that I'm only one person. We grew rather fast. There's about 500 people at the organization now, and for a period of time it was just me for the benefits and the compensation side. And so as new hires came on and as things came up, I was the only person there available to assist them, which wasn't scalable and wasn't always as readily available as people would have loved to have.
Wow, so everyone was coming to you with all of their questions, and you felt maybe you would provide a better experience by having some support there. That's understandable. All right, and let's move to the next question. So how did you choose your advocacy solution? What were you looking for? Were there any key components that were really important to you as you were evaluating different options, and how did you make that decision?
Yeah, so it was important to me that this did not feel like an 800 number that led them to a wall, or like an email that led them to somebody giving them how to get to step one. And even though that person knew that after step one was going to come 5 more steps, they just kind of would let the employee come back with each step and more questions. So someone that was proactive, someone that felt similar to if they came to a partner within their own organization, they're getting the same feel. So they don't feel outsourced. They don't feel like they're just being sent over here to somebody else because I don't have time for them. So I was pretty familiar with the different advocacy options, as I did benefits brokerage in my prior life and had vetted this for clients before. And the 24/7 concept wasn't as important to me as the service. So I needed the service to really be a quick response and be high touch and look around the corner for these employees. Most people dealing in benefits have never done it before, and they don't know that once they do this thing, now the provider or now the vendor is going to need 5 more things, or that they're going to need to now call this other specialist. Now they've got this one lined up. And so I needed them to have a partner that could make this feel actually easier and not just make it feel like, okay, I got the yes, now I got to go get another question and come back for more answers.
Right. So they would have to figure out the next question before they ask it versus someone figuring that out on their behalf. Understood. Correct. That's really important, and definitely something that we hear a lot. So I can appreciate that, and thanks for that answer. All right, let's move on. So the big question, why TouchCare? Why did you choose TouchCare as a solution versus all of the other solutions that are out there?
I really felt like TouchCare was going to actually live up to the concierge piece of this. People can be an advocate and not make it feel like there is sort of a white glove element to this. And at the end of the day, at least within our population, if employees feel like where I've sent them is not taking care of them to the extent that they know they could get internally, they're going to turn right back around and come right back to me. And so it just won't be very useful. And I wanted to make sure that there were different options for employees to communicate, depending on the generation of employee, depending on what the employee has going on in their day-to-day life. They may want to dial a phone call, they may want to shoot an email, they may want to get on their mobile app. And I liked that TouchCare had all of these elements of outreach so that that way somebody could communicate in the way that made the most sense for them and that was most effective for them.
Right.
And when I called the references, I was very impressed, by what I was hearing from the references. I know everyone always kind of is like, well, why references? They're all always only going to be good, but I've had a number of times where reference was not very good, and it really kind of stuck out that people felt very cared for, and it was beyond what I typically heard. It wasn't just, oh yeah, they're good, they answer their benefits questions, they get them. It was, hey, I remember this situation where this employee just needed, just above and beyond what I could have imagined was needed, and the entire team came together and took care of them, which is what I was looking for. I needed a team that could truly take care of the employee and not just say, well, I only do billing, so we'll have to start something else for you to find your parent their home caregiver, things like that.
Well, I love that. And I love everything that you're saying. Starting working with this company when we started really the advocacy component 4.5 years ago, that was our goal. And every person on the team is taught to work with a member as though it's their mother, their grandparent, a close family member, so that they can really dive in to assist that person with all the knowledge that they have, but also realizing not everyone on the team is an expert in everything. So that's why we have that pod approach, so
Mm-hmm.
they can really leverage one another and make sure that the billing specialist that is aligned with the organization, who knows the benefits, can work with that health assistant to really create a holistic approach for that member. So I'm really glad that that's important to you, because it's important to me too. And we've always looked at building the team as, what's broken out there and what would we want that experience to look like as a member ourselves, because we're humans too. We all go to the doctor, we all have healthcare needs. So, what does that experience need to look like in comparison to, what we would expect for our own families and for ourselves? So, super important. I'm really glad you called that out, because it's equally important to us. That's great. Okay, let's go to the next question. So I want to know how this has helped you personally in your role, but also your employees. So you mentioned you are a one-stop shop, one-person individual, and for benefits, really. And I'm sure you have a little bit of support, but what does this look like for you? And talk to us a little bit about how the team supports you, and when you have a need, what that looks like.
Yeah, so they really become a partner for our employees. So in many different ways. I've had so many different situations. I feel like within the benefits side of the house, you hear all things. People come to you the minute whether they have a medical issue, their parent has a medical issue, and they come for any and all. I think because they know they're coming to you with their health information, they come to you with just about everything.
Mm-hmm.
And I've been able to really tell employees, look, I don't know all the answers. I can't make these calls. I can't, figure out, why your bill is wrong. I can't figure out how to get you into that specialist, but there is a team of people that can. And really, once I am able to reach out to TouchCare and ask them to assign an advocate for this employee, it 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 never comes back to me, honestly. The employees, I've circled back with a couple of them, because there's always the fear that, oh, they stopped talking, maybe it's because they gave up after they didn't get what they needed. But every time I've talked with someone, they've really said, look, they helped take care of what I needed, they helped take care of what I needed for my family member. And in situations where they just didn't have the bandwidth, a lot of times mentally, to process everything,
Right.
when employees are going out in medical leaves, or family leaves, they have so much they're processing just from what they're going through, to
Right.
then have to call up and go through the process of filing all the right paperwork and getting all their ducks in a row is a lot. It's very difficult. And when they hear that they have a concierge member who can take that on for them, they're relieved, and a lot of them are shocked to hear that we have this. They're just like, wow, this is unbelievable. I can't believe that somebody's actually truly going to help me with this. So it's been wonderful for them.
Oh, that's so great. We always have to remember, because we have a team of experts, right, who've been doing this for a very long time. But we have to remember that a majority of the population can't define simple terminology within benefits, right? So when we're interacting with them, we have to, really wrap our arms around that situation and explain things in a way they can understand that resonates. And it, as you mentioned, it is a stressful time. They're experiencing other things on top of this now administrative component that they don't know anything about, and they'll probably only have to deal with once or twice in their lifetime. So why become an expert, right? Um,
Yep.
it's a privilege to be there for them, and I'm really glad you can appreciate that as well. Gosh,
Yep.
we have a great partnership. All right, move on to the next question. All right. So, how do you rely on advocacy today? I know this might be a little redundant because we've had a pretty good conversation here, but talking about even from the inception of a new employee, what does that look like for you within TouchCare?
I really, especially given kind of our fast growth and how lean we run as an organization, I look at everything really from an efficiency standpoint. How can I streamline things? How can I rely on our vendors and our partnerships in order to put employees in the right hands to get them to the point they need with as much individualized care? And so from the moment our employees come through the door, they're encouraged to create a relationship or have a contact with TouchCare. Our new hire onboarding, I tell them if you have any providers in place, should be shooting an email over to them, telling them who the provider is and asking them to make sure they're in network. Once you get your cards, you should shoot an email to them with your new medical ID numbers, or just take a picture of your medical card and give them your provider information and say, hey, call up all my providers and make sure they have the right medical information on hand. We try very hard to communicate to them throughout the different phases of what they're doing with our company, how this can be helpful. So it's not only for if you need something urgent or you can't find something, that's great. But everyday stuff that you're doing in the healthcare world, I tell people if you have something in the healthcare world, you should be reaching out to TouchCare. You need to make an appointment, but you just haven't had the time because between calling them and coordinating, just send TouchCare your availability and have them call and work on making your, I mean, it's amazing how much that we're able to sort of weed this in just from a day-to-day basis. And then even when, especially when employees have a leave or a serious medical condition, one of the first things I do is reach out and find them a healthcare advocate. Because even when they say, don't worry, I've got it under wraps, I'm like, if you're going through a serious condition or a leave, it's a matter of time before you run into a bill that just you weren't prepared for, it just doesn't seem right. Or you run into being outsourced to a specialist who doesn't have availability and you want to see someone sooner, or you don't like this specialist, can you help find me a new one? There's just so many things that can happen so quickly. And for them to have someone to just turn to and say, I need this, I can't imagine where to start, has just been, all of them have just come and said, like, this has made such a difference. Especially right now with so much mental health going on in the world, a lot of employees that we deal with are just so beaten down mentally. They need someone to take that next step for them. They're too worn out to do the next thing. And it's great to have a team of people that can help do that for them.
Yeah, I mean, Sam, I have to say, during this pandemic, we really experienced quite a significant number of issues that, are out of everyone's control. And as you've mentioned, advocacy becomes that much more important during this time when people are super stressed out and have all of these additional challenges and needs that they wouldn't typically have before. So we're happy to provide that help. And I think that this whole conversation really speaks volumes to how great of a client you are and how great of a partner you've been from the beginning, because we really focus on, educating not only our member population, but our clients, and making sure that that partnership aspect is defined, immediately. So when we have that orientation call, really walking through, hey, here's what this relationship looks like. Here's what this partnership looks like. Here are the resources that we're going to share with you. Here are, the resources, within people and what that's going to look like. And, you know, here's your dedicated account manager. So do you feel like you always have a contact that you can go to within TouchCare personally?
Yes. Yeah. Our account manager is so responsive, and I never feel like, you know, ironically in the beginning, because of honestly prior partnerships when I'm used to, I went to reach out to sort of the group TouchCare email to receive support, and my case manager came back and they were like, oh no, like, don't do that. Like, come directly to me, because we don't want you to kind of get sourced out into a group thing, and we'll make sure someone direct con. Like, I was surprised. I took sort of the, you know, group route that I'm used to, and got a much more high touch level. And they've just been really good about partnering around coming up with ideas on how to communicate this out, on how to drive utilization. It's been great.
Well, again, you know, I love to hear that. So that's great news, and thank you so much for sharing that. I appreciate it. All right, next question. All right, so is there any employee feedback? You've mentioned that you've gone to some of your employees. I know we've gotten great feedback from Apellis members, and we love to share, you know, all feedback that members provide to us. So talk to us a little bit about any feedback that you've received about our solution.
Yeah, I mean, I will say the feedback I get is just the the person was very helpful, and the person was able to get them what they needed and able to answer their questions and connect dots. And the biggest part of all of this has really been around working with and communicating with employees. You know, I will say transparently, especially when someone's on leave, sometimes they don't always reply to the advocate right away, or sometimes they don't think they need it and they kind of leave it, and you got to guide them back to it, just because it's so, especially for if employees haven't had this before, the concept's new to them. They can't believe there's actually someone out here that's gonna help them in this manner. And when they go through it, the feedback I get is just, holy crap, that took so much off my plate. Like, I'm not
Yeah.
dealing with it anymore. They actually took care of it. I'm actually just watching them do the back and forth, and I'm not having to do anything. So it's been great to hear that it's doing exactly what we say it's going to do, which is, I tell people, you don't have to make those phone calls. You don't have to sit on hold. You don't have to put your time and your mental energy into it. They will take it for you. And that's exactly what I'm hearing.
Fantastic. Great news again. All right, let's move to the next slide. This is just additional feedback that was added. So Sam, I just want to thank you so much for your partnership, for being a great client, for allowing us to engage the way that we appreciate engaging, so that not only you, but your employee population can learn about what advocacy is and how we can align with them when there is a need. I always like to say during our orientation calls, when we get to the slide about what it is that we do, this slide could be 8,000 slides long, right? Because there's so many different types of questions that individuals can ask us, and so many different needs that employees might have. Everybody has a different experience. You know, I always use myself as an example. If we're sitting in a room and I'm sitting next to someone, you know, same age, similar everything, except I have 6 kids, right? And they don't. And we have different situations. So my needs are going to be very different than their needs. My benefits are going to be very different from their benefits. And it's always really important that everybody feels supported and that everyone's treated as an individual. So we appreciate your time, and we appreciate you taking part in this very, very much. I'm sure there will be questions. So if you just hang on for those questions, that would be much appreciated.
No problem.
All right, so the TouchCare difference, we could go on, and as stated throughout this presentation, you know, our data shows that by having a concierge service, you don't just save money. You know, a lot of people are really focused on money and the stress of healthcare, the lack of knowledge within healthcare. We do so much for our members and even for our clients and our brokers to really support them, which in the end results in a better experience, a happier population, And it does end up saving money because of the educational component. So we've talked a lot about the different statistics of saving, per employee. But overall, I can't stress enough the importance of that educational component and our ability to navigate and remind employees of even different opportunities that they have for virtual management versus physical management, and reducing those ER visits. Then time that's saved when you contact even providers to make an appointment. It could be a back and forth experience for a couple of weeks. So allowing someone to do that on an employee's behalf and just, get them back to work, get them, doing something more productive versus than managing administratively their own experience is very, very helpful. So with TouchCare, no more waste, right? We're here to help become or help create better consumers in healthcare. And again, saving money. We're here to assist with those bills, which 50% are incorrect as a reminder, and 50% are correct. So again, that education process, really, going in and navigating on behalf of the member and creating that price transparency. I always like to use my son as an example with that. A couple of years ago, he was a senior at the University of Delaware, and he needed an MRI. So he went to urgent care. It was late at night. He was doing something that a lot of college students do. I think he was playing soccer or something at midnight. And he had to go to urgent care and he needed an MRI. And they said, oh, we'll set you up. Here's where you're going to go. And he called me. He was super proud and said, I know where I'm going. I checked their network. And I asked them to please go ahead and send me the information. Submitted the information to the team so that we could get an idea of cost, because full transparency, I'm on a high deductible plan because I know a little bit about insurance, thankfully. And when he came back to me, or when I received the information, based upon the CPT code of the MRI that he needed, the location that he was being sent to was $2,500 for the MRI versus a standalone facility 5 minutes away with an appointment available the very next day for $460. So there was a significant savings, and not going through that experience would have been, very costly for even our family. And it really taught, even him, the difference between, what that contracted negotiated rate might mean, even in network. So every experience provides value, and even within my own family, we're able to use those price transparency components to make a big difference. All right, so again, thank you for joining our webinar today. We are happy to answer any questions that you might have. So we're going to go into our chat and look to see what questions have been asked. Can you tell us more about mental health services within TouchCare? Absolutely. So we do have a mind care solution that is available, which is a teletherapy solution for our organizations. It is a buyout, but it does offer a virtual component for mental health. I can tell you that throughout this pandemic, mental health is the one area that has become more and more challenging to find brick and mortar providers, right? So when individuals reach out and they say, I need to find a therapist and I want them, 5 minutes from my house, that's become really challenging because a lot of therapists are completely tapped out. A lot aren't accepting new patients any longer. And I have several even friends who are therapists, and they're like, this is unbelievable. And so it is much more challenging to find brick and mortar therapists than it has been in years past. And so Mind Care is a solution that we offer that is a virtual solution for our client population that they can definitely ask more about, learn more about, and provide the virtual therapy and even psychiatry option for our members. But we also support, if there is a supplemental option within the carrier, or, other components that our clients have decided to move forward with, and we'll support this as well and make sure that we're navigating on that employee's behalf. All right, so if an employee reaches out for support, what is the anticipated response time? Our response times are, if an individual reaches out via technology, our response times are immediate. But we assess the information and then we assign that individual to the correct person on the team who's specialized to really assist that person most effectively. So we do initiate that type of engagement within 1 hour after an individual reaches out, meaning, we've initially reached out, we've gotten all the information, and they begin interacting with their specialist. Obviously, if you call, we have a team on staff who's waiting to receive your call. If everyone in your pod is on the line, you will have a 30 to 40-second hold time. You leave a message, and we'll call you back. We say within an hour, but that's typically 15 to 20 minutes for that callback time. What is the average implementation timeline? So Sam, do you want to take a little bit about implementation and talk about that? And then I can add a little bit of content with regard to the timeline.
Yeah, so I remember going in very quick. I will say I don't remember the exact timeline. I want to say it was under, I don't want to put you guys, but I feel like it was under 30 days. The biggest lift within the implementation, which is just putting in the details around your benefits, but I say lift in that depends on how detailed you want to be. You're not necessarily required to put in everything and anything. I just wanted to be able to put in as many summaries and as many details as possible so that when they actually reached out to the advocates had everything that I had at their fingertips that I have at mine, so that I had as few employees, on hold or waiting to get things. But it was just very easy. It was very fluid to go through. I don't remember there being anything that I would change about it.
Oh, that's great. I love to hear that. So we also have a portal that provides direct access. So individuals, meaning clients or brokers, have access to a client admin portal where all of their information can be uploaded directly. Those plan summaries that Sam was mentioning can be uploaded and named directly. A simple census file and with some pretty clear information, right, needs to be uploaded. So that timeline is typically, if it's a larger organization and we're really being strategic with rollout, we do require 30 days. We've implemented obviously much quicker than that. So it really depends on the needs within the organization and what you're trying to achieve. Obviously, if we're supporting open enrollment, it might look a little bit different than if you're going live with the full solution immediately. So there are just some considerations there, but typically 30 days, I'd say, is the correct timeline. And oftentimes, we implement it in a couple of weeks, but we love 30 days if we can get it. Okay. Do concierge services support employees with family planning? 100%, many times every single day. Employees are reaching out to us. And it's funny because oftentimes that conversation begins during that open enrollment discussion that we're having, or they'll reach out and just say, they'll ask that simple benefits question. We're thinking of expanding our family. Within the benefits that I have now, what would that look like, right? If they're not selecting that new plan. So again, the red flag goes off and we begin talking to them about our solution and discussing, are they asking an IVF question or are they asking about, hey, I'm going to expand my family. What's this looking like? Do they have different providers? Do they need a specialist? Are they high risk or are they not? So that family planning navigation, yes, we're very deeply involved with our members when they do reach out with those types of questions and needs. And we support them as extensively as possible with anything that they might need. But especially, that question typically comes up during the open enrollment process when people are, assessing their plans. They're also asking a lot about, what is a qualifying life event? When I have the child, what does that mean for my benefits? How long do I have to add them to my plan? Should I assess my, my significant other's plan? So there are a lot of those types of questions as well. Not just, I'm having a child and where's my doctor? Or can you help me find a doctor? All right, these are great questions. It looks like we've answered all of the questions that are in the chat. Again, you're happy or welcome to reach out to us and our sales team absolutely anytime. Thank you so much for joining. And Sam, thanks again for your time today. We really appreciate hearing from one of our great clients, and we really appreciate all the content and value that you've supplied through this webinar. Thank you.
No problem. Thank you.
All right, and thanks to all of our attendees. This presentation will be provided to everyone. It's been recorded and will be sent out. Again, please reach out to us with any questions. Thanks so much and have a great rest of your week.